Now at 6, comfort arrives, the floating U.S. Navy lifeline now in New York City that will relieve pressure from overwhelmed hospitals.
Nursing home lockdown, a COVID outbreak kills 8 patients. More could be infected. The scramble to stop the spread.
The same scientists who developed treatment for Ebola in West Africa are now
stacking up at soup kitchens as unemployment rises. Good evening, I'm Chuck Scarborough reporting from home.
And I'm Natalie Pasquarella. Help is pouring in, but the cases continue to rise in New York City. A child with an underlying condition has now died from the virus. That's the first in the city. But we do have some better news. The hospitalization rate for the state is slowing, now doubling every 6 days instead of every 2 days. The USNS Comfort arrived today at Pier 90, adding to the arsenal of 3 temporary hospitals slated to open. The Javits Center is ready for patients now, the Comfort and Central Park tomorrow. New Jersey saw 3,200 new cases in 24 hours. There are now more than 16,000 cases here and 198 deaths. In Connecticut, more than 2,500 cases, 36 deaths. And New York has half of all U.S. cases, with more than 66,000 people positive and 1,218 deaths. News 4's Andrew Siff is on the west side with the wave of help just pouring into the city. Andrew.
It is, Natalie, and Mayor de Blasio said here's the goal: to triple the city's hospital capacity by May 1st. That's about a month away. Tripling capacity, otherwise the current hospital system will be overwhelmed by coronavirus patients. In the meantime, the USNS Comfort, which you see behind me across the West Side Highway, will be ready starting tomorrow to receive non-coronavirus patients, 1,000 of them. 1,000 beds on a naval ship, 1,000 beds in the convention center, and dozens of beds in Central Park. Piece by piece, the city and state are building capacity for non-coronavirus patients, so when the virus spikes even higher in April, the hospitals have a fighting chance.
This is a monumental task.
Yonkers native Todd Mangan is commander in charge of the USNS Comfort, which reached New York Harbor today, available for patients tomorrow.
You're combining the tenacity of the people of the city of New York and then the Navy.
So far, what New York hasn't been able to do is stop the surge of novel coronavirus.
It's a lot of loss, it's a lot of pain.
And the arrival of the Comfort ship created an unintended consequence. Big crowds on the West Side Highway when social distancing is required to slow the virus. The police later thinned the groups. But I also asked the mayor about his decision not to close city playgrounds. Why do we not have consistency on that guideline for social distancing?
This is an issue that obviously we're working with the state on. I don't think taking away parks is a great idea unless we have evidence that people are not following the rules.
Thus far, they have not been successful. If that continues, we'll take a mandatory action to close down playgrounds.
As for the Comfort, the ship struck a personal chord for Tom Von Essen. He remembers when this same vessel provided grief counseling after 9/11, when he was the city's fire commissioner.
The flashbacks I get, knowing that the city is under such stress now, it's real personal for me.
Back live now, you can see the NYPD. They've had a pretty steady parade of police cars trying to disperse the crowds across the West Side Highway, making the announcement this is a hospital, not a tourist attraction. We're live on the West Side. Andrew Siff, News 4 New York.
All right, Andrew, thank you very much. Now, in New Jersey, the death toll rose by a little over 3 dozen over the last 24 hours. Almost 200 people now dead in New Jersey from the coronavirus. Many of them are nursing home patients. In fact, eight died at a facility in Wanacue. News 4's Brian Thompson is live in Wanacue. And Brian, that facility is on lockdown tonight.
Absolutely, Chuck. And the reason I'm wearing a mask is this is a hot zone now. But when you gave that number of 8 and then the statewide total of how many died overnight, they're not the same. The 8 were not included in that count. This was basically a surprise to the health department this morning when I reached out to them. They do say that 20% of all long-term care facilities in New Jersey have at least one patient or resident with coronavirus, but nowhere that we know of in the tri-state has gone through this kind of tragedy of this dimension. Two nursing assistants hugging each other called on this morning with no idea they would be working at a long-term care home where 8 people have died in recent days from the novel coronavirus.
I'm freaking out right now.
I got grandkids, you know?
I have cancer. Well, I'm a cancer survivor. I have lupus and I have asthma.
No comment from Lakeland this afternoon. In fact, neither the governor's office nor top officials at the state health department seem to be aware of this fatal outbreak when we called them earlier today. Once informed, the governor said at his daily news conference,
"We know that lots of folks out there are worried about moms and dads, grandfathers and grandmothers who are in facilities around the state. We're doing everything we can."
While Lakeland is now on lockdown with an unspecified number of coronavirus-infected residents inside, it is not being evacuated as at St. Joe's in Woodbridge just last week, where 3 died and at least 24 residents were tested positive, but there was a nursing staff shortage there. Since some staff here are contract workers called in just today, despite not knowing what they were getting into, these 2 assistants told me they're not going anywhere.
The patients need us.
The patients need us.
I'm a healthcare worker. I cannot do
I
them
can't
like
turn my
that.
back.
So
at the end of the day,
I've
when
been
it's
in this
over,
field
this
for
coronavirus
16
is
years.
over. At the end of the
So
day,
I
I'm here
gotta
for my
work.
patients.
The patients need us. That's what those 2 women said, despite their own health concerns, about their own surprise at finding out that this is now infested with coronavirus residents here and the virus itself. The patients need us. Live in Wanacue, Brian Thompson, News 4 New York.
And those women so appreciated. All right, Brian, thank you. Well, Connecticut now reporting nearly 2,600 confirmed coronavirus cases. That includes nearly 1,500 in Fairfield County. The state health department says that the death toll in Connecticut is now at 36, including 21 in Fairfield County. A short time ago, Governor Lamont announced a delivery of 111,000 N95 masks and 146,000 surgical masks. But he called that amount small, given the rate at which those items are being used. While Governor Cuomo is renewing his call for healthcare workers from across the U.S. to sign up and help the cause here at home. That's because healthcare workers here say they're already overwhelmed. News 4's Chris Glorioso live with stories from the front line. Chris.
Well, oftentimes at hospitals all across the tri-state, the healthcare workers are either too busy or too tired to speak publicly about the frontline fight against COVID. But when they do speak, people listen. And today, I had the opportunity to speak to a head nurse in Brooklyn who says the cases she's seeing are so severe and so time-consuming, her colleagues often have no time to eat, to rest, or even go to the restroom.
We're seeing multi-organ failure as a result of the disease process. It's respiratory issues, it's a cardiac issue.
Sheena Tanis leads the coronary care nursing team overnight at Brooklyn's Brookdale Hospital. It's one of the city's hardest hit facilities, with a refrigerated trailer acting as a makeshift morgue out back.
You're coming in from shifts that you are so physically and mentally drained.
Tanis told us one of the hardest things about her hospital shift is the anxiety of coming home. Like lots of families, she has kids with asthma and a parent with underlying conditions.
I'm scared for myself, scared that I'll be home. I have 2 young children that have asthma.
And one more thing she's been thinking about, how COVID is a disease exacerbating the gulf between healthcare for the rich and healthcare for the poor. While field hospitals being set up in Manhattan are a welcome sign, Tanis is concerned patients in underserved communities like those around Brookdale have higher rates of asthma, diabetes, and heart disease.
The patients that are coming in are in their 30s, they're in their 40s, they're in their 50s, they're in their 60s. So we need to have as much attention brought to those underserved communities so that we can get the support needed to ensure that communities are appropriately cared for.
Sheena Tanis told me this is the most challenging period of her more than 2 decades career as a critical care nurse, and that's critical care, the most serious patients. She says she has cried with her coworkers, but she did provide a bit of good news. She said at the moment, Brookdale Hospital does have enough PPE. She's hoping it stays that way. We're now reporting live in Essex County, New Jersey. Chris Glorioso, News 4 New York.
All right, Chris, at least I'm glad to hear the last part. Well, I suppose you could call it the pandemic that is a boot camp, pandemic boot camp. First responders gearing up to meet the special challenges posed by this pandemic. News 4 Chief Investigative Reporter Sarah Wallace takes us inside the new cutting-edge safety training you won't see anywhere else from Hillside, New Jersey.
Go, go, go.
It's emergency calls like this, an unconscious patient that is now putting the Hillside, New Jersey Fire Department on high alert. The firefighters, also trained as EMTs or paramedics, now donning personal protective equipment or PPEs for every medical call.
We have to treat almost every call now as it may be a COVID-19 call. It adds a stress. It adds an unseen stress coming to work that you didn't have before.
One guy's in the back of the ambulance. It's gowned up, full PPE. The other gentleman is in the front seat of the vehicle, the door closed, keeping that distance, that barrier.
PPEs bagged and secured out in the field. Ambulances scrubbed clean after every call. A new learning curve for the men here used to battling something tangible.
Your nerves get higher because you got to worry about the unknown. Usually things would stay at work, but now with this, if we get infected, we're bringing it home to our family. And that's what kind of scares me the most.
I haven't seen my grandson in weeks because I won't go to the house and my daughter won't bring him around. So it does have an effect even on our family life.
And then the second pair of gloves over the top.
Today, a refresher course for the firefighters on PPE protocols held by MD1, mobile emergency doctors supporting first responders.
It's not something before COVID-19 that we used to do every single day. We certainly did training, but only about twice per year. And now we just want to get every provider up to the proper skill set.
You just, it's already on, you just put it right in.
Then training on PAPRs, powered air purifying respirators, considered the go-to device for the future.
This is a superior level of protection to an N95 mask. Essentially, there's a fan, there's a battery, and then there's filters. The air comes in through the filters, sucked in by the fan, goes down the hose into the hood, which then gets put on.
We've heard a lot about shortages of masks and gowns and gloves around the country. Well, PAPRs are also back ordered. Major companies are now stepping up to increase production of these. From Hillside, New Jersey, Sarah Wallace, News 4 New York.